Hi, how are you?
I really apologize.
Oh, no, it's okay.
We didn't mean it to be African time. It
Good to
just
see you.
happened. Good
Thank
to see
you so
you,
much.
sir.
Thank you.
Thank you.
Hi, how are you?
Yeah.
My name is George.
Hi,
How are you?
how are you?
Good, how are you?
Good to see you.
Hi, how are you?
Thank
Nice to meet you. My name is Tim.
And I'm Lydia.
Nice to meet you.
Nice to meet you.
Please. We've got room over here.
Oh, yeah, is that one? Okay.
Yeah, please. Would you like any coffee? Or, oh, you've got it. Okay.
Thank you
Kathy's
so
all
much.
right.
Village,
Right.
the whole village shows up. You know, they
Yeah.
gotta come and meet, and so because you couldn't come,
Right.
we brought our senator right here.
Oh, that's great. That's
Thank
great.
you.
Now, how many senators are there?
Everybody here, and you know, I think everybody's from this. Oh, I was looking for you. Yeah, I mean, so we call this home, and we love that diversity, and more so for that reason, you find there's a lot more immigrants concentrated in this city and
Right.
Kenya than actually many other places.
Right.
And also the accessibility of services. I mean, like when we are doing whether it's one-stop business licensing,
Right.
and then like now we have quite a number of the nonprofits that have been acting as their trusted messengers, and just being able to have that conversation between the city or even the location or the state, and then growing together, and so that everybody gets together value in as well as contribute to the society.
Right.
Yeah, and so on behalf of the nonprofits, because we do have a consortium for which I'm the Secretary General, yeah, I want to let you know that we are happy with our steps. That's federal way.
Now, how long have you been in Federal Way?
Since 2011.
Oh, wow.
Yeah.
11 years.
Yeah.
How do you like it?
I love it.
Yeah.
I mean, my house, like where I go to sleep, is in Kent. But I do have another house here, business house actually, and also my office is here.
Yeah.
So I spend more time in Federal Way.
Right.
Actually, I know more people in Federal Way and everything about Federal Way than Kent.
It is true that we spend so much time in our work lives
Right.
that it is you know such a separation really between your work home and your and your other home. Yeah.
Yes. I mean, you Senator, you can hardly get into any store in Federal Way and not run into a Kenyan.
Yeah.
That is true. You know, when I say as you walk,
Hardly.
like 10 people or 20 people, you find one.
Federal Way, hardly.
Yeah.
Yeah, any store, anytime. So this is our our home base technically, and so we are delighted that you could also come and meet with our mayor. And who knows?
So, how long have you been a senator?
5 years now.
A lot of people move here.
One of the conversations that has been really gaining momentum in our community is a lot of the providers or healthcare and in-home based care providers are from specific regions of Africa, specifically Kenya. To put it in context, we have about, give and take, 3,700 adult family homes in the state, and down here to in King County, or even specifically Federal Way. I'll just give a rough estimate in relation to the community members, Kenyans who own adult family homes. I'll float a number of 200. You know, because we do a lot of resources distribution for the small businesses. So one of the things that has been really evolving is around healthcare. And because there's a lot of sometimes barriers that crop up. There are some other systemic barriers that show up. There's the issue of the socioeconomic issues. And so one role our organization plays is the trusted messenger role, whereby we are reaching out to our people and telling them it is okay, and then reaching out to the government and saying, you tell us what's going on here, so then we put a cultural lens to it. So bringing it back to this conversation is because they've been mapping like the issue of the community clinics, and the issue of what our sisters and brothers in the Hispanic communities have achieved under the CIMAS
Right.
clinics programs. And so these are people working in healthcare, a lot of them healthcare professionals, not only providers but professionals, living and working and investing in federal way, and saying, we still cannot get our employees low-cost access to
Right.
some level of care, right? Because of all these other barriers that ride on each other. And so they've been asking, they ask me sometimes when I'm not coming to the councils, I'm like, okay, we'll talk. But now that you're here, I might as well. So they say, is there a way we can collaborate and have some clinics that angle in on the East African immigrant population?
Right.
Because, and then they say, Anna, my name is Anna, they say, Anna, the Hispanic community has done it.
Right, they have.
And we also have our own medics, we have our own healthcare professionals. Is there a way? So maybe just to throw it out there, because healthcare is universal, which means that if such a city or a county considered it, that would be an area of collaboration that would be easy to create a framework.
Right.
Does that make sense?
Yeah, it does.
Because then it would benefit the city, whatever that might come up, but at the same time back here, it's easy to map it because there's a need.
That's right.
Which I'm very, very sure that the state and also in conjunction with the city can work together and say, okay, let's come up and see if we can come up with a health center, health clinic.
I like that. A great deal. Well, and we should, we could get
So there was a time when 𝐼CHS was considering coming to Federal Way. I don't know if you recall that.
I do.
There was a conversation with Tim Johnson. So is there like a health clinic that you can think of outside of Harborview or those medical facilities that can come to Federal Way and be here? Because we as a city are not in the healthcare business.
Right.
However, it's a conversation to have and to partner.
Yeah, and that's the thing, because then that's where the community comes in, because we actually right now we have quite a good number of medics, trained and fully, we have registered nurses. In other words, what is missing, or the support that they would be looking at, is the infrastructure. So just like the infrastructure that helps or supports the Hispanic community be able to run under CIMA community clinics.
Right. Exactly.
Exactly. Yeah. That's the part.
Exactly. Yeah. Exactly. So I think it's just thinking around the framework, and then working together with your city and their city or the county, whatever level, and saying, okay, so maybe because healthcare is universal. We need it here, and they need it, whether it's Nairobi, whether it's Cameroon, or whatever it is. I'm just thinking about, because I know one of the considerations, like you mentioned, is the compatibility.
Right.
Or something that you have where you have that partnership where you are exchanging ideas or thoughts or building something on. Otherwise, it would just be, hey, hello, I love you, bye.
What part of the country were you from?
Or in Kenya, the same city, Murang'a.
Murang'a.
Yes.
And
it's a small town.
Right. Okay. What size do you think? What population? What do you think?
Yes, the population of that city is about 100,000, almost like here.
Yeah.